In today's video, we will talk about the diagnostic coding errors and how to avoid them. So, diagnostic coding are usually systems like RCD-10CM and CPT is the critical for accurate billing, resemblation, compliance, and patient data reporting. Errors can lead to the claim declines, renewal losses, audits, and even legal penalties. Before in a detailed overview of a common diagnostic coding errors and how to avoid them. So, what are the common diagnostic errors? So, first of all, we will talk about the upcoding. So, upcoding is simply defined as the assessing a code that reflects a more severe diagnosis than documented. For example, coding accurate respiratory failure when documentation support only shortness of breathing. So what is the impact? There are compliance risk, insurance audits, financial penalties. So how to avoid? Code strictly on provider documented, avoid assumptions, conduct regular compliance audits. So next we will talk about the downcoding. It is simply defined as the assessing a less severe code than documented. Impact, revenue losses, inaccurate patient severe reporting. So how to avoid? Review documentation thoroughly, understanding severity level and specificity requirement. So next we will talk about the unspecific code overuse. Using unspecific code when more specific code are available. So for example, using unspecific pneumonia instead of identifying bacteria or a viral causes documented. So what are the impact? Claim declines, reduce resemblation, and last one is the poor data qualities. So how to avoid them? So queries providers for a clarification. Use the most specific code supported by a documentation. So next we will talk about the incorrect patient diagnosis. So it is defined as the selecting the wrong condition as the main reason of the encounter. What are the impact? There are DRG, payment reaccuracy, audit risk. So how to avoid them? Follow official coding guidelines, understanding sequences rules. So what are the missing laterality? So it is defined as the following to specify left, right, or a bilateral when required. Coding fracture of an arm without identifying which arm. So how to avoid them? Review documentation for laterality, use coding manual, and system promotes carefully. So next we will talk about the coding for assumptions. It is defined as the interpreting lab result for a clinical sign without provider's confirmation. What are the rules? Code cannot be diagnosed, only reported documented diagnosis. So how to avoid them? Queries the provider when unclear. Never code directly from the lab values only. So next we will talk about the failure to update codes. Coding guideline changes annual, especially with ICD-10 updated. So what are the impacts? Outdated codes, claim rejection. How to avoid them? Attend annual coding updates, subscribe to coding bulletins, uses update coding software. So next we will talk about the not linking diagnosis to the procedures. It is simply defined as to the failure justify medical necessity by linking diagnosis codes to procedure coding. So what are the impacts? Claim declines, medical necessity rejection. How to avoid them? Ensure diagnosis supports procedure. Follow prior policies. So all about this common diagnosis. So next we will talk about the best practice to avoid errors. So that are strong documentation practice, in that clear, complete and specific provider notes, standardized templates. So next we will talk about the regular coding audits, that is the initial and external audits, random chat reviews. So next we will talk about the continuous education, that are annual certification update and training on the new code and the prayer rules. So next we will talk about the ongoing training. So in ongoing training there are coding is the procedure in that coding. So what are the consequences of the coding errors? So that are claim declines, delays reassemblation, compliance penalty, legal risk, fail claims at laboratory, damage to organizational reputation. By focusing on the accuracy, specificity, compliance, and ongoing education, healthcare organization can significantly reduce coding errors and protect both revenues and regulatory standards. So today all about this video. So thank you for watching this video.